Hey, everybody, this is Dr. Jon Petrick, the host of the Ask Dr. John show. And today we're going to be talking about hormones, nutraceuticals, and a company that I've grown to love, Evexias Health. And we're going to be, our guest today on the show is Ryan Bell. He's the West Coast Regional Director for Evexias. And without further ado, I'd love to introduce you to Mr. Ryan Bell. Hi, Ryan. Welcome to the show.
Hey, thanks, Dr. John. How are you doing today?
We're doing fantastic. Thanks for taking time out of your busy day. I appreciate it. And all our viewers, they're going to appreciate it too, because there's a lot of questions. My email's constantly full with people asking me about hormones, about pellets, about different companies and about different products, nutraceuticals. And if you're not familiar with the nutraceutical, we're going to dive into a little bit about that. But so West Coast Regional, sales manager, tell me a little bit about your role with Evexias, and then we'll jump into what Evexias is, and then we'll kind of jump into some of the patented processes that they have. So tell me a little bit about what you do for the company.
Yeah, perfect. So, like I said, I oversee kind of Arizona, Nevada, Hawaii, and Southern California. Basically, what we do is we work with practitioners that can help implement different hormone therapy and peptides into their practice with nutraceuticals to really, provide a better patient outcome to their patients. Kind of more of like a root cause medicine. So Evexias Health Solutions, what we do is we're an overarching kind of company that under that umbrella, we really provide kind of like a business in a box, if you will, to practices, that are able to implement it with the technology, implement it with dosing, help them out with patient education, help with the medical training for the practitioners, for the staff. So we really want, the ultimate goal is improved patient outcomes. And we kind of have figured out how can we work backwards from that to the practitioner side of the standpoint to achieve that.
And when I first heard about Evexias, one of the things that attracted me to it was I was down in Dallas. I was invited down there to attend one of their seminars, and I think there was 465 medical doctors down there, and I was the only chiropractic physician in the room. And for many years, chiropractic has always been about wellness. And what was so enriched and enlightening to hear was how many physicians had really, they really weren't necessarily pleased with how they had been treating patients for many years. And I was so excited to hear Terry, the founder of the company, and all of the speakers that were there were really talking about getting back to the root cause, not always treating a disease or a symptom, but actually looking at the human and concentrating on, actually what was the cause of it, not necessarily treating the symptoms of it. Can you expand a little bit on that for us?
Yeah, absolutely. One of the things, so Dr. Terry Denai, she's, our founder and chief medical officer, started out, kind of more emergency medicine where they were just always, putting Band-Aids on everything. Typically, a lot of what we see is traditional Western medicine kind of doing that, where a patient comes in, they don't look as far as to find out like what is causing that potential issue. And so they end up just, prescribing something. And don't get me wrong, there is 1000% a place for that kind of medicine. We wouldn't, there's so many different things. We need those kinds of medicines and those kinds of therapies. But when we look at the overall health of the country and we see it kind of steadily declining with all of this advances in technology, she kind of was like, there has to be a better way to go about this. And one of the better ways was hormone therapy. Our body has a hormone receptor on literally every single cell of the body. And so you think if we're trying to look at how do we better ourselves and when are we in our most optimal health, it's when we're in our late teens, our early 20s, mid 20s, and then steadily probably we hit 30s and maybe we still can do pretty well. Then fit 40, it kind of usually goes down a little bit. And then thereafter, well, what's also too happening during that time? Our testosterone levels are steadily also declining in that same time frame for men. For women, it's like they hit kind of this perimenopause where they're kind of a little up and down, but then they just, about once they hit full menopause, they just have a immediate drop off. So we wanted a better way to have medicine, brought towards for the patients to improve their patient outcomes through a preventative aspect side of things. And we're seeing, the growth of it rapidly expanding because of patients. They're talking to their friends and their family that they're finally feeling better. And so, like you said, we had these docs that, kind of before didn't learn this, unfortunately, in their initial schooling. So they are kind of like, well, what is this thing you guys are doing here? This seems kind of so different than what I'm used to. And all it took was him taking that one step back of like, you know what, maybe there is more out there to learn for me to help my patients. And then they have that passion to do so.
You know, with the Evexias method, what I was impressed with, it wasn't just looking at one particular number. And when we looked at testosterone numbers range from 300 to 1200 and considered in a normal range. And that's a big difference from a man that's got 300 and 1200. And another thing that people don't realize, that we always concentrate kind of on the females and say that women go through menopause, but there's actually a condition in men called andropause. And the number was, I think, at the age of 35, a man's testosterone goes down by 1 to 10% every year after the age of 35. And that's their sex drive. They get cloudiness, they get fatigued, they're labored through, they get, the dad bod, proverbial dad bod that they have, they can't lose weight, and they're going to the gym like they used to, as you mentioned, in the early 20s, and they can't maintain. And the other thing that was impressive to me was, again, they weren't looking at one particular number, and the numbers that we always were taught to look for in school was, let's look at cholesterol, blood pressure, TSH, and these other things. And now we realize, wait, that really has very little bearing on the overall health of the patient. So with Evexias, they're looking at their vitamin D, they're looking at iodine, we're looking at cortisol, we're looking at testosterone, and we're also looking at their insulin sensitivity. And those 5 things were, for me, it was like, wow, this is eye-opening, because there are a lot of patients that if we just looked at those 5 markers, that really tells us so much more information based upon other than just their cholesterol.
Absolutely. And, one of the things too is, we don't say like, we obviously want to get that bottom number, what their kind of like baseline is, but we also too, we want to know what symptoms they're suffering from, because too many times docs just treat just the number, and they're chasing this kind of number and not kind of individualizing it to the patient. Because where I may feel phenomenal at 1,000, for you, depending on like your sex hormone binding globulin and other lifestyle factors, it may take you, 1,100, or on the contrary, you may feel awesome at 800. So, one, getting the numbers is important, but also too, looking kind of at like the lifestyle, what they're doing, from a sleep standpoint, exercise, nutrition, stress management, relationship building, all of those things, definitely matter as well too, in addition to the labs, in addition to the symptoms. So like I said, kind of having this like full body understanding of kind of like the why behind they're feeling the way they're feeling. And, bringing that in. So part of our training also too goes over kind of nutrition. It goes over the nutraceuticals of what we're not getting in our food system these days. The different things, and the endocrine disruptors that we're also too being exposed to on a daily basis, where we see now guys and women in their, 20s, mid 20s, early 30s that have the same overall testosterone levels as guys and females in their like 60s. Because of all of these different endocrine disruptors in skincare and the water and then the food and all this stuff. So, now more than ever, it's important to understand, like where your levels are at. And that's kind of one of the things we say, like, find out where that testosterone therapy or hormone therapy may not be for you at this particular junction in your life. You may be able to just, get by and drastically improve it with diet, nutrition, chiropractic care, and just getting your body flowing and adjusting the way it's supposed to and run the way it's supposed to naturally.
And I hear that all the time in practice. And a lot of the doctors I'm talking to are saying that they're having patients come in. They're saying, well, I went to my doctor and he told me that my testosterone was within normal range. And one of the things, Ryan, that we always tell our patients, that there's such a thing as normal and then there's optimal. And you may have 300 or 400, but you feel like crap. And, they're having problems. They don't have any desire. They're fatigued. They're falling asleep at red lights. They get home on the couch. All these symptoms that they're having. So I always tell my patients that we don't chase a number. What we're chasing is how you're feeling. And so we always try to be able to improve that. And so I think it's important, again, that for the people out there listening, is that don't always rely on a number. It's more important that we listen to you as a patient and take your response and your subjective of how you're feeling as opposed to what a particular number is. So, one of the other things too I wanted to ask you is, you mentioned a word and a lot of people may not know it. So I want us to be clear on it. What is a nutraceutical and why is it important?
Yeah, so nutraceutical, you may heard the more common term is supplement. Supplement is something, that you're usually utilizing to supplement your body. What a nutraceutical is a prescriptive grade, essentially supplement, to where we know exactly what's in that we know what's in that nutraceutical, because it has pharmaceutical grade, to be able to, when you take it, you know exactly what you're getting in, and it actually shows up in labs as well too. So many times now they've seen their articles coming out left and right on different tests being done, and like on stuff from Amazon, stuff from CVS and Target, and all these different places where they test what's in there, and what's supposed to be in there is not in there. And or there are extra stuff in there, which is even more concerning. It's one thing to not get to get the proper dose what's in there, but it's another thing to have stuff that's not even listed in there. All of a sudden, when you do a test, that actually shows up in there. With Amazon, you can literally, put something together, and I could be selling it on Amazon next week, and there's no really oversight on it. So, we want to make sure stuff where you're getting it from is, NSF, CGMP, comes from a CGMP certified facility, where that what you're actually is going into that supplement your body needs.
And a lot of that's marketing. My father was a Colonel of the Marine Corps. So if you put a bottle out there that had a Marine Corps emblem on it, that entices me, or, a pretty woman or a handsome guy on there, with no shirt and ripped up. So a lot of times it's marketing, and that doesn't always equate to, to a good product. And what I liked about Evexias in their line was, as you said, they're pharmaceutical grade. They were designed by MDs. They were designed in the lab and manufactured in the lab. So as a physician, you could take comfort in knowing what you're giving your clients or your patients is something that is limited. It's listed on the bottle. You know what you're giving them, and you can trust that. Too many times people come in and they say, oh, I'm taking this, but their health, it doesn't demonstrate that they're getting really the good product. So I always appreciate that about Evexias. It's kind of that authenticity and keeping that moral standard, because as a physician, our number one job is to do no harm. And a lot of these nutraceuticals can actually hurt people. A lot of times they take the advice of their Aunt Sheila down the road, who said, hey, I take this, you should too. But again, one of the reasons why it's so important is we look at the labs. And again, we're looking at the insulin sensitivity, their cortisol, which is their stress, their vitamin D. When it comes to the testosterone, what I'd like to talk a little bit about is what makes Evexias different is through their Evexipel, which is their pelleting system, because the pellets are different, their process is different, and overall it's an entirely different process, and it's getting better each year. What I've noticed, when pellets have been around a long time, but now could you explain a little bit about the Evexias, the Evexipel process and their pellets?
Yeah, so pellets were actually one of the very first modalities of hormone therapy, clear back in the 1930s. So they've been around a long time. It's just, a lot of the other modalities got a lot more press time, if you will, like the injections and the creams, stuff like that. So pellets, like I said, have been around for a while. And then one of the nice things that we've done as a company is we're always trying to look at ways to, like, once again, I said from the beginning, is it all ends up at the patient outcomes. Like, what can we do to improve patient outcomes? And then let's work backward from there. Well, we did the same thing with our pellets. The formulation of it. So not all pellets are created the same, just kind of like all medicine's not created the same. How pellets are, formulated is different from company to company to company. So when you're choosing a company, we have our own actual patent on our pellet. It took hundreds and patient attestations and provider attestations, essentially saying like our pellet worked better for their patients and provided better patient outcomes. So less extrusions, less bruising, quicker recovery time, less scarring, are all things, that we're able to utilize in the formulation of our pellet, from the way we compress it, from being more of a horizontally compressed pellet to being, the way we granulate it versus a powder testosterone. Adding triamcinolone to the pellet, to reduce the inflammation and keep it, local, instead of having it a small enough amount where it's not getting systemic, infused throughout the entire pellet. So that was kind of the first iteration of that, of kind of what we've done to advance the medicine. And then kind of the next thing was like, was changing the location on the males. So, males typically, as they age, they start to lose their glutes, if you will, and they start to kind of hold their, their weight in their upper body and their torso, and the kind of like the abdominal area.
The love handle area, correct?
Love handle area, exactly. And so we're like, for the guys, we're like, why are we still pelleting guys in the glutes when they don't have any space there? And it was causing all these kind of uncomfortableness and issues. So we had one of our nurse practitioners, decided like, hey, why aren't we doing it for guys in the love handle? And we're like, well, let's give that a try. There's plenty of space to do it there. Let's give that a try. Sure enough, the clinic started seeing all of these guys asking for this particular nurse practitioner to do their therapy. So then as a company, we're like, oh my gosh, we have something here. Let's change it. And then kind of the most recent iteration was trocars have always been done. Trocars have always been like this kind of like beveled edge, sharp trocar, where you're kind of like twisting into the tissue, cutting, and you're kind of creating this trauma, if you will, underneath that subcutaneous tissue.
Which created the bruising and the pain and the
oozing, pain, extrusions, encapsulation, seromas, infections, all of these different kind of, like I said, reasons typically why docs and patients have kind of shied away potentially from pellet therapy. And so we now kind of utilize more of like a atraumatic technique to where now instead of twisting and cutting, we're basically just kind of weaving through those tissues. Now we're not creating any of that scarring tissue. We're not twisting. We're not cutting through anything. And so it just prevents all those issues from happening. And then what it also too just provides a better patient, outcome and response too. They feel better. It doesn't hurt. It doesn't hurt for like weeks at a time like it used to for the males, and even for the females. It maybe never extruded before, but it was uncomfortable. For like the whole next week. Now it's like the next day they're like, yeah, I think I got pelleted. I'm not really sure. I forgot which side it was, because like I said, they're not in pain anymore from between that combination of the insertion, atraumatic insertion, and that patented pellet that we have.
And one of the things too is that there's very limited amount of blood. As before, when they were cutting into tissue, the patients used to bleed. Now, when the doctors are putting the pellets in, there's ultimately no blood. And when you talk about a trocar, you're talking about the device that kind of puts a hole into the tissue, and then the pellets kind of follow in behind it, and they kind of put it in there. So it's flat on the surface, or it doesn't have a sharp edge that was cutting the tissue. So there's really no blood.
Almost so this is like a dull pencil. It's basically just kind of about this almost like diameter of a pencil, if you will. And so the pellets, the largest pellets is like size of a Tic Tac. For most of the females, like size of a grain of rice. So it's about like this size. Yeah. So where you're literally just kind of like weaving in there, and then you just drop the pellets in. And the procedure for females, it's quick, easy, takes about, 10, 12 minutes max. And for guys, it's about 12 to 15, just because we need more lidocaine, and we're probably bigger babies. So we want to make sure we don't feel anything.
And I can testify, Ryan, I had my pellets done, probably about 2 months ago. And I was absolutely surprised at how much lack of pain there was, lack of soreness. The next day I felt just a little bit of like, I could feel it. That took about 24 hours. And then there was absolutely nothing. And when I'm talking to a patient, they ask me, how long do the pellets last? How long do I have to get these pellets done? And I always like to tell them, I said, it's kind of like licking a lollipop. The more licks on the lollipop, the faster you're going to get, you're going to burn through that testosterone. So the more active the patient is, the faster they're going to use up that testosterone. Is if they're home sitting on the couch as a couch potato, then their pellets are going to last. But what is typically the average length of time for a man and a woman that they're going to have pellets? How long are they going to last, and when do they have to get them redone?
Yeah, and that's a great kind of analogy as well too, is kind of saying that, like, because it's like every time your metabolism goes up, kind of naturally the way your body responds, it's going to kind of increase your testosterone, when you're doing exercise activity. So kind of the same thing. So the more active you are, type A personality, stress, whatever, those all kind of raise your heart rate up. So for females, it's going to last anywhere from 3 to 5 months. Kind of like I said, you're more active person, they're going to probably get them done about every 3.5 months. Versus your type B, kind of less active person, could probably extend them out to, 4.5, 5 months. For the females, for the guys, it's about 4 to 6 months. So they get a bit longer. We get a lot more testosterone total, obviously, for what we need. So for the guys, it lasts anywhere from 4 to 6 months, kind of the same thing. The more active you are, the closer to that 4-month range you're going to be. So me personally, I work out, 4 to 5 days a week, go hiking several days a week. Busy job, so I'm getting mine done almost right at 4 months and a couple week or so, and then I'm just like renewing mine like clockwork the last, 2 years. And it's kind of like what you said, at the next day you can go like, oh, I feel like something like was there, and then it doesn't hurt. You can just kind of like feel something's there. It just kind of feels different more than anything, of like, it feels I feel something in there, I feel something different. And then within like a day or two, it's like, it's like nothing ever happened, other than you just have this little steri strip on there to, heal everything back up for you.
Also, one of the things too with what I loved about it, but one of the questions that I always get is, what am I supposed to feel and how soon am I going to feel it? Could you answer a little bit about that? So that, a lot of patients are wondering, as soon as they get them in, they're thinking it's a magic wand, everything starts
Superman all of a sudden, or Superwoman immediately next day.
But explain a little bit about that, because I think a lot of people don't really understand what they should be feeling, when they should be feeling it, and how soon they should be feeling it.
Yeah. So typically it takes about 2.5 weeks to kind of get all the way kind of to your optimal level, if you will. So we typically get labs at around like the 4-week level once you get your first insertion, to kind of see where you're at. But typically those first kind of things you'll start noticing, feeling better. You're going to start noticing you're sleeping better within the first usually 2 to 3 days. You'll start noticing your sleep is getting a little bit better. Your energy starts getting a little bit better. Your mood actually regulation, you start noticing that, and kind of having this kind of about 4 to 5 days in, you kind of start noticing your mood just being kind of a little bit more, I call it kind of, especially for guys, kind of having this like kind of zest for life again. A lot of guys kind of like in their, once they get, kind of like their 40s, kind of have this like kind of doldrum, kind of loser, kind of like zest for life that you have, kind of like the vigor that you had in your 20s. And that's one of the things you kind of also notice that kind of start coming back again. And then it's kind of the same thing for females. They're kind of getting this kind of this like noticing their energy within, like I said, usually it's that first week or so. And then it kind of like about 3 weeks to 4 weeks, like I said, depending on how active you are, is when you kind of get in this optimal range. And then the nice thing versus like the other modalities where you're kind of having this kind of like roller coaster up and down, or like injections, you're having these really big roller coasters up and down. With the pellets, it's just kind of like this like nice, steady, even rise up. We get a hover in this like optimal range for a much longer time. And then those first symptoms that you started noticing going away when you got the therapy are going to be the same ones that kind of slowly start to return when you're kind of like coming back down. And then by then you're kind of going to be due for your renewal. So for pellets, we never want them to get clear down into the trough and kind of like that, their starting point. Again, once we get them up here in the optimal, once they start getting down about halfway or so-ish, we're kind of repelleting them. So we're kind of on this like almost, instead of like a roller coaster, we're on this like low rolling hills instead. So it just makes a much smoother process for the patients.
Another question that always comes up too is, what about sexual health in regards to testosterone? So for men and women, being on testosterone is something that they're going to notice a difference, not necessarily in their, let's say, performance, but their desire. Is that something that's associated with testosterone as well?
Oh yeah, absolutely. So that's one of probably the top 3 symptoms of having, low testosterone and having suboptimal estrogen levels is another thing too. A lot of males, are taking estrogen blockers, and that actually is affecting their sexual performance. It gives them, more ED issues actually than before had they not taken it. Because, for guys, we need estrogen, but testosterone, is a great thing for improving libido in males and for females. And one of the things I hear very often working with all the docs is, the docs tell me that if one spouse gets the therapy and the other one doesn't, it's not long before they're dragging the other one in, because they're on uneven playing fields, and one's ready, vigorous and ready to roll, and the other one's kind of like, hey, pump the brakes a little bit there. So like, I need you pelleted. I need to get you in here.
And, Ryan, it's extremely important. It isn't just for, people in their 40s and 50s. 5 weeks ago, my mother, 77 years old, we pelleted her. Now, obviously, for various different reasons. And one of the reasons was the research now on testosterone and estrogen is showing its prevention of cancer. Women have 8-to-1 Alzheimer's compared to men. And we kind of equate that to the drop in estrogen and the drop in testosterone. Can you talk a little bit about that? Because right now, 1 in 8 people are developing some sort of cancer. 1 in, again, 8 times the men versus women. Women are having Alzheimer's. Can you talk a little bit about the benefits of testosterone and estrogen and prevention of cancer and Alzheimer's?
Yeah, so one of the big things that testosterone also helps to do is it helps with your insulin regulation. And Alzheimer's, a lot of, and in many other countries, is actually like called type 3 diabetes, because your body's not metabolizing and utilizing insulin as it should. So it's kind of shutting down. So testosterone, really helps people get on the therapy, because some of the symptoms that you mentioned earlier, like the libido or the brain fog or the night sweats, so that's kind of sometimes why they get on the therapy. But why they stay on the therapy is because, the preventative aspects that it helps, in the research has shown with cardiovascular disease prevention, osteoporosis, osteoarthritis, especially older women. Hip fractures are one of the top leading causes of death, because once they break a hip, you see almost within the year a drastic decline in their health. So if we can help prevent osteoporosis and osteoarthritis from even happening in the first place, and then same thing with metabolic disease, Alzheimer's as well too. Testosterone. There's so much research coming out about how it's not just for libido, or it's not just for hot flashes. That's kind of like the old mantra. And they had the Women's Health Initiative study that came back in 2002 that initially scared off a lot of people on hormone therapy, saying that hormones can cause cancer. That made the front page of Time. What didn't make the front page of Time magazine was in 2017, the redacted version of that, where the authors themselves actually said that no, that's not what actually the study showed. It was only the synthetic progestin and estrogen arms that caused that, not the actual bioidentical version. So we kind of ask,
and that's what Evexias is, right? Where it's bioidentical, it's not synthetic. Which is ironic, because a lot of times insurances will pay for the synthetic and they won't pay for the bioidentical. And to me, that blows my mind. There actually is, again, I'm not going to beat up big pharma. That's not what this call is about. But if you're looking at it, they're wanting to say, oh yeah, we're going to do it, but we're going to give you something that has been known to cause cancer, and they won't pay oftentimes for a bioidentical hormone. And that's what Evexias is. And again, another reason why Everready Health and the company that I'm the clinical director for, why we liked it, because it was a bioidentical. Can you talk a little bit about that?
Yeah. So, you think bioidentical, your body actually recognizes those molecules as, replacing it with what it normally would have had in the first place. So instead of having, this kind of foreign body under it, and then kind of having to go through a bunch of extra processes to determine like how to actually utilize this, with the bioidentical version, your body knows exactly what to do with it when it enters into the body. And one of the nice things, with the pellets is you don't have that first pass through the liver as well too, that, sometimes doing the oral, which has caused some of these issues before as well too. And many of the studies, talk about estrogen, but they're talking a lot of them about the synthetic version of it, because anytime in a study, you'll start noticing if they're talking about the bioidentical version, they're going to say 17 beta estradiol. And so that's a massive difference between the two. Kind of the same thing as progesterone. They say, if they're saying micronized progesterone, that's going to be the bioidentical version, versus progestin is going to be the synthetic version. So if you're just skimming through something like that, many times people will send articles in and be like, hey, this is what I found. Like, and then when you break it down, even doctors, they're like, oh my gosh, like, they make this awful confusing, don't they? I'm like,
yeah,
like, unfortunately they do, but that's why companies like us exist, is to try to like really show like what the true research is actually saying about how it actually helps patients, and what a lot of other countries have known for decades, that now the United States is like really trying to get into the research as well too, and try to show, docs, like recently they just lifted the black box warning on testosterone, just like less than 2 months ago. So we're turning in the right direction, which is, a really positive thing. And it's largely being patient driven. There's so much education and research out there that this is being patient driven now, which is the great thing.
Well, one more big question before we wrap it up is one of the, I want you to address briefly is, women are thinking, and people are thinking they're going to grow beards, and, they're going to have, men are thinking I'm going to get man boobs and all these types of things. Can you talk a little bit about that before we wrap it up?
Yeah. So, symptomatology, there typically it does increase, hair growth, midline hair growth for men and for women. But it's usually minuscule. women may get like an extra like whisker or two here, but every time the doc says like, oh, hey, let me adjust your dose, they're like, you do not dare touch my testosterone dose, because they are feeling so good. They're like, that's what lasers are invented for. And guys, you know,
it's a rare thing. Excessive hair growth is a rare thing, right?
Yeah, it's rare, like I said, and that's usually if their dose is if they're getting dosed too high. So that's one of the things we help the practitioners, and they're trained on how to appropriately dose patients. So that's, you know, rare happening. And then for guys, you know, thinking they're going to get like gynecomastia or something like that. For one thing with the testosterone, the only way that that's usually happening is if they actually have like a genetic condition predisposed to it. So once again, extremely rare. We over 500 plus thousand pellet procedures done in our company, and we haven't seen one single case of that happening. So like I said, typically if it is, it's doing the injections and doing it more than they're supposed to, more than they're actually getting prescribed from doing the injections, and they're on an estrogen blocker as well too. So there's usually like a combination of things for that to happen. But the testosterone, you know, for the side effects for some can sometimes be acne, sometimes can be, they do have some side effects, but once again, they're easily manageable. Most of them can be mitigated with simple steps that your practitioner, you know, knows how to do. You know, you guys have been trained how to mitigate and manage these kinds of things. And kind of like this, like the old adage or the old saying is, you know, the dose is in the poison, you know, is, you know, like if you're giving everything appropriately, the chances of those happening are very, very slim.
Ryan, I always love chatting with you. I always learn something, or I get back to really my roots, and that is loving for our patients and providing the best optimal care. Thank you so much for being on the show today. I'd love to have you back on the show to kind of discuss further. And because Evexias is way more than just testosterone, there's so many different products and nutraceuticals. I'd love to bring you back on the shows. We can discuss some of the individual products that you have and so many other features to the Evexias program. So, hey, it's Dr. Jon Petrick with the Ask Dr. Jon show. If you're wanting more information on testosterone, you can reach out to us. Give us a call at 702-948-2520. You can check out my website, drjonpetrick.com. Or as I said, don't settle for feeling good when you can be feeling great. So many, as Ryan said, 500,000 procedures have been done with limited, almost no side effects going on here. So check it out. Once again, it's Evexias.com. It's Dr. Jon Petrick on the Ask Dr. Jon show. Tune in next time when we bring Ryan back to talk a little bit more about some of those products. Thank you all so much, and God bless.
All right. Thanks.